Okay, so this is your canine RRE video. So what we're going to do is outline some exercises that you would be asked to demonstrate in your exams using the dog. So we're going to talk through how you would do these, and this is for you to refer back to. So the first exercise that you would obviously probably include in your plan, if the patient is able to walk, is slow lead walking. Okay, so you need to make sure the dog is at a heel at the side of you, and you're walking the dog nice and slowly. So a nice slow pace for the dog, making sure you turn them nice and wide at the top. And you probably talk about in your exams, obviously trying to keep the dog in a nice straight line, and when you're starting early rehab, you're trying to avoid any excessive weaving or turning of the dog. Right, the next exercise that we're going to demonstrate with you is static weight shifting. So in your exam, you're going to need to engage your handler. So you're going to have to ask your handler to hold the dog either side of the collar in front, and then get the dog into a standing position where they're nice and square. So you can see here Helen's adjusting the dog, so the dog's nice and square. And then she's going to demonstrate cranial to caudal weight shifting first of all, so pushing from the front of the chest backwards, very gently. What you don't want the dog to do is to hyperextend through the spine and go kyphotic, so you don't want to push them excessively, so it's just a nice gentle rock. Then we can do lateral weight shifting in front. So hand either side of the chest. And just gently rock the dog from side to side in front. And then you can do hind end weight shifting, so you can do lateral, supporting either side of the pelvis. And then you can do caudal to cranial, but you have to be very careful with this one, as the dog can. So that's cranial to caudal, and then you can push them from the bottom forwards. But you can see here that Helen's doing it very, very gently, because what you can get is you can get hyperextension of the spine if you push excessively from behind. So you can make them actually roach up through the lumbar region, which you don't want to do. We can increase the intensity of this exercise by placing them on a wobble cushion. So we can do this by individual feet, or we can place the front end of the dog or the back end of the dog. So first of all, we're going to show how you would scale this up. So you'd start with memory foam to increase your intensity. So you can ask the dog to walk on. Again, your handler is supporting either side of the collar in front. Just ensure your dog is nice and square, and also that they're not standing with their legs out too far behind them. And again, you can perform exactly the same weight shifting that you would have done on the ground, but you're now just doing it on a slightly unstable surface with them raised slightly in front. And then you can also raise the back end, so if you were going to target a condition in front. So here Helen's just asking the dog to just gently put a little bit more weight on the hind end. And then you do side to side in front. And you can So the same principles would apply with the wobble cushion. So the next stage, you go from static to memory foam, then to wobble cushion. So ignore that bit I previously said. So with this, you can do an individual foot if you really want to target just one limb. So you can stand the dog as Helen and Lauren have there, and then you can do the weight shift, and then what you're doing is getting much more targeted isometric contractions just to one limb. So we're just targeting the forelimb here. You could do the hind end, but the same principles of asking the dog to stand on the cushion would be the same. And then you can just then, as Bracken's done very nicely for us there, is place both feet on the cushion. So the dog is now a lot more unstable. To increase the intensity of this, you can take the air out so you can make it less stable. So this is fairly unstable, so if you had a more advanced dog, you'd have a lot less air in it. Or if you're starting out with early rehab, you may inflate it more. So we're going to show you some peanut ball exercises now. So these are very advanced, so you can use it in dogs that are neurological and cannot stand. So you can place the dog over the peanut ball. Obviously this ball is quite high for Bracken, but we'll see how she gets on. So that would be very advanced hind end weight shifting. So you can see that she's elevated with both paws up on the ball. So we can decrease the intensity of this by asking her to bend her elbows and lie on the ball. So that means that her hind end is less hyperextended. This one's a bit tricky because then you just have to make sure that obviously behind, like she's just done there, she's readjusted herself so she's square. So you can make it less advanced by doing that. And then you can ask them to stand with the ball underneath their tummy. It's probably, we'll see if that's it. See, that's it. And then we use that with very weak neurological patients to support them underneath their abdomen. So that would be the least intense exercise for them. So that's assisted standing, and then you can use it to do weight shifting while they're standing on it. Then you can advance it up by the elbow placement that we just showed you, and then you can make it more intense by then standing them with their legs completely elevated off the ball. You can ask them to place the back end on the ball as well and ask them to load the front end, but that's very advanced and you wouldn't need to demonstrate that within an OSCE. The next exercise that we're going to go through is poles. So for the purposes of your exams, you'd always start with one pole, then you assess whether the patient can walk over it. So again, all the exercises for remedial exercise should be done at a slow walk. We don't do any trotting or faster gaits unless we're trying to do sport fitting for advanced dogs. So we've spaced the poles out here, so this is trial and error, and you can do this in your exams. What we are looking for is a foot in each runner, and these have been spaced well. So she clipped that one, but that's fine. So we're just assessing our spacing. So Bracken is obviously older, so she does struggle to pick up her back end. So this isn't, them knocking a pole is not uncommon. Obviously, if a dog was to, now she's skipping one. That's it. Obviously, if a dog was to completely, constantly keep clipping or missing spacings, that was good, then obviously the exercise would not be of benefit. So to raise the poles, you would raise the last one first, and you only put one end of the pole in. So you can just see here that Lauren's just using the other one as a bit of support, and we've only raised one end. This is so that as you walk the dog over, if the dog is struggling, what they don't do is fall over the pole. So you just want to make sure that if they knock it, it's only going to knock forwards and they're not going to collapse. So you'd always do the last one first, but she's fine, so we know that that's fine. Then you then start to raise subsequent poles. And you can just hear there that she just clips the last one. Again, you need to make sure with remedial exercise that they can cope with the poles on the ground before you obviously raise them. So if a dog's clipping a pole, that doesn't mean that you make them higher. It means that you should reduce them back onto the ground if the dog can't cope with them being elevated. You can, for neurological dogs, you can place poles in a haphazard fashion, like a maze, and make them the spacing random, or you can alternate them so you can have one raised, one low, the spacing different, just like Lauren's just done there, just to play with it a little bit. If you're doing sort of neurological rehab, also sort of sport fitting for dogs as well. That's a really good exercise to place them with different spacing and different heights to challenge them further. So the next exercise that we're going to move on to is, first of all, would be weaves. So you've got weaves, figures of eights and circles, and how you progress up these exercises is you start with weaving first. So that should be your first exercise, and then you would maybe put that in for a couple of weeks and then look at progressing it further. And that's just because weaves allow for more bending, whereas a figure of eight, you're getting a tight turn at the top. So you can see here, Lauren is checking the spacing with her feet. So we say 6 to 8 foot. Obviously, Bracken is a smaller dog, so we've gone for 6 foot. And then you can see here that Helen is doing it nice and slow, but also walking the dog round very, very wide. So how we would increase the intensity of this exercise, which we'll just show you while we're filming, is we'd make the spacing a lot smaller. So we're going to go 3 foot apart now, and then you can see how much more challenging that is for the dog. So that's why when we first start with early rehab, we make sure that the space nice and far apart, because the dogs find this far more challenging. So you can see that Bracken's gone a lot shorter behind, and she's finding it harder to turn. So that's why Helen's having to still try and give her quite a wide distance at the top. Right, so we're going to progress this on to figures of eights. So if Lauren's going to take out the centre cone, and that would be the correct spacing. So you just need 2 cones for figures of eights. And this is basically where you're just doing serpentines, nice and slowly, round the cones. And that would be how you perform figures of eights. Again, you can make that far more challenging to the dog. We're not going to do that to Bracken because she's going to struggle with turning tight at both ends and having it very close together. So the next exercise that we're going to space out for is circles. So you want 4 cones, and you're going to, again, measure them out to make sure that your diameter of the circle is not too big. So you're going to go 6 feet across, and then come back into the centre, and then go 3 out, and then 3 out the other way. Don't do 3 across and then 6 out either side, because you'll end up with an oblong. Right, then the idea with circles is that you place the dog on the inside, so what they can't do is try and cheat and not bend. We're going to go nice and wide with Bracken, because obviously she's an older lady. We're going to go nice and slowly with her. The principles of circles is that you should go in both directions also. So once you've done one in one direction, you should turn the dog round, and then you should go in the other direction, keeping the dog on the inside. There are other exercises in your handout, such as dancing, but we're not going to demonstrate that here because none of the cases that you're going to get in your remedial exercise plans for your exams are going to be advanced enough for you to do that. However, we are going to show you a sit to stand because that is one of the exercises that is in your handout. So with this exercise, you're going to try and get the dog to sit as squarely as possible on the spot. And then you're going to ask them to come forwards and raise, but on the spot. And then you're going to take them back down into a sit, then back up into a stand. So with this exercise, you're asking them to push up from the hind limb rather than pull from the front. So that's a really good one at building hind limb musculature and asking the dog to rise. But that is all your remedial exercises. They are all the ones that you would be asked to potentially perform if it was relevant to the case for your exams. And as you can see, Bracken's now died. I hope you found that very helpful.